Good morning everyone and welcome to our new facilities here at the Bayside Sports Club. The director of our allied health team here at Bayside Sports Club has asked myself, Ryan, along with my fellow podiatrists at the club, Geordie, Aaron, Joel and Chris, to investigate the lower limb pathology of patellofemoral pain syndrome. As most of you may know, our club has been riddled with knee injuries this season, so we've been asked to investigate risk factors associated with patellofemoral pain syndrome, in particular, the presence of a pronated foot type. This is all in an effort to hopefully identify risk factors associated with the condition and put in motion strategies to reduce the prevalence of patellofemoral pain syndrome in our athletes.
Patellofemoral pain syndrome is one of the most common lower extremity conditions reported in physically active populations and encompasses disorders in which pain and point tenderness are present in or around the patellofemoral joint. The main epidemiological risk factors for developing patellofemoral pain syndrome include gender, runners, and previous victims of anterior knee pain. In regard to gender, a study conducted by Bowling 2009 listed the female sex as a significant risk factor in the development of patellofemoral pain syndrome, and this is further supported by Thies 2008, who conducted a study looking at 102 runners. From this population, a sample of 17 runners developed patellofemoral pain syndrome, with 16 of these being female. Furthermore, studies estimate that the yearly incidence of running injuries is between 37 and 56%, with patellofemoral pain syndrome being the most prevalent injury amongst these runners. In relation to the recurring nature of the pathology, Bowling 2009 found that of the 22 patients who were examined 4 to 18 years after presentation of patellofemoral pain syndrome, 91% still had knee pain, and 68% of these individuals were female. Despite its high prevalence, little is known regarding the risk factors that predispose people to patellofemoral pain syndrome, and while many risk factors have been theorized, few studies have prospectively evaluated all these risk factors. Excessive foot pronation is a factor that has been theorized to predispose individuals to the development of patellofemoral pain syndrome. However, review of the current literature shows evidence on this theory to be inconclusive. In the study conducted by Thies 2008, the relationship between standing foot posture using the FPI-6 and patellofemoral pain syndrome was evaluated, as well as the relationship between gait-related pronation and patellofemoral pain syndrome. It was determined that there was no significant relationship between the said factors, as shown by the statistics in Figure 4. Another study conducted by Hetzroni 2006 had similar findings with factors of pronation such as range of pronation and pronation angle lacking supportive evidence, and the only factor that was found to be statistically significant in pronation velocity was not consistent between the 2 feet, as seen in Table 2. Various other risk factors have been proposed for the condition of patellofemoral pain syndrome, such as tibial rotation, vertical peak forces, and muscular strength of surrounding structures. However, I will allow Geordie to continue this discussion in more detail.
The prospective study conducted by Hetzroni did find pronation velocity to be a risk factor for patellofemoral pain syndrome, and it's thought that prolonged pronation of the foot during gait produces excessive internal tibial rotation, and as a result of this, it then generates abnormal forces to the proximal joints like the knee, and these irregular stresses on the lower limb increase lateral patellofemoral contact pressure, and this increase in pressure can lead to an overuse injury and ultimately the pathology. Although this cohort study did find pronation velocity to be statistically significant, it is advised that these results should be interpreted with caution, as the association to patellofemoral pain syndrome was found to be contraindicated between the left and right foot. So high vertical peak force underneath the second metatarsal near the end of propulsion phase and the lateral heel during heel strike was identified as a risk factor in the study conducted by Tejas et al. And this is thought to cause higher vertical forces being transferred to the more proximal structures like the knee. And this larger impact shock can potentially cause an excessive load on the patellofemoral joint, which can possibly lead to an overload of the joint and ultimately the development of the pathology. So the prospective cohort study by Bowling et al. Found multiple risk factors, and these included decreased quadricep and hamstring strength, increased hip external rotator strength, and increased navicular drop. Additional risk factors were also identified in a jump landing task, and these were decreased knee flexion angle, decreased vertical ground reaction force, and increased hip internal rotation angle. Decreased strength of the quadriceps is a risk factor for the pathology, as the vastus lateralis and vastus medialis muscles have been shown to play an important role as the dynamic stabilizers of the patella. And in turn, if these muscles were to be weak, it can potentially lead to patellar maltracking. The decreased hamstring strength isn't fully understood in the development of the pathology. However, it may be due to an overall weakness in the thigh musculature in people who develop the pathology. This decrease in quadriceps strength is thought to also decrease the knee flexion angle in the jump landing exercise, as this task demands a large amount of eccentric force from the quadricep group, which is evidently lacking in people from the injury group. Increased navicular drop is thought to increase the hip internal rotation angle, and this internal rotation then may lead to a laterally aligned patella. Increased hip external rotator strength is thought to be due to the increased hip internal rotation angle during the jump landing task. And in the subjects who developed the pathology, it's thought they were using their hip external rotators to counteract the increased hip internal rotation during the dynamic exercise. These people may have developed the increased strength over time in an attempt to counteract the internal rotation angle. So steps were taken in the study to understand decreased vertical ground reaction force in those who developed the pathology by evaluating knee and hip flexion displacement during the stance phase to determine if people who developed the pathology had a decreased amount of displacement. And this could potentially mean they don't efficiently absorb vertical ground reaction forces. However, they found there was no difference between the injured and non-injured group. And therefore, when looking at decreased vertical ground reaction force as a risk factor, it warrants further investigation and therefore should be interpreted with caution. And lastly, it should be noted that excessive foot pronation has been theorized to predispose people to patellofemoral pain syndrome due to the associated internal rotation of the tibia. However, across the 3 studies, they were all shown not to support the hypothesis.
For the ask aspect, a structured question was formulated using the PICO mnemonic. Considering that the studies that were used were all prospective cohort studies, there was no control group or comparison that could be measured. The population was patellofemoral pain syndrome in active individuals. The intervention, pronated foot posture. As mentioned previously, no comparison or control group were present. And lastly, the outcome was an increase in patellofemoral pain prevalence in those with a pronated foot posture. Therefore, our formulated question is, does a pronated foot posture contribute to the prevalence of patellofemoral pain syndrome in active individuals?
As a team, we acquired and appraised 3 different studies which attempted to identify risk factors for the progression of patellofemoral pain syndrome. More specifically, we sought to analyse studies to see if there was any association between the pronated foot type and the development of the condition. The study by Boyling 2009, a prospective investigation of biomechanical risk factors for patellofemoral pain syndrome, was conducted to investigate the modifiable risk factors associated with the condition. The 2009 study by Boyling is a prospective cohort study making a level 3-2 on the MHMRC levels of evidence hierarchy. A well-defined group of 1,597 shipmen were enrolled in the study over a period of 3 years, with pre-enrollment criteria including no previous injury, limiting lower extremity strength or tasks. At the conclusion of this study, it was found that overall risk of patellofemoral pain syndrome for this population was 3%, with a 95% confidence interval of 15 injuries per the 1,000 to 29 injuries per the 1,000. P-values were obtained for kinematic, kinetic and posture-associated risk factors, with that p-value being 0.04 as seen. Muscle strength and posture risk factors were also investigated, with a p-value for these being 0.02. These p-values both identify no association between the investigated variables and the development of the condition. Furthermore, the presence of a pronated foot type could not be associated with the development of patellofemoral pain syndrome. Another study we analysed was titled Gait-Related Intrinsic Risk Factors for Patellofemoral Pain in Novice Recreational Runners by Thys, 2008. The prospective cohort study by Thys is a level 3-2 study on the MHMRC levels of evidence hierarchy. This particular study followed a group of 102 novice runners with no known history of knee or lower leg injuries or complaints. Prior to commencing the running program, all participants were screened for standing foot posture and plantar pressures during running. During the 10-week program, a single sports medical physician registered any and all sports injuries sustained by the runners. At the conclusion of the study, 17 of the 102 runners had developed patellofemoral pain. Higher vertical peak force under the lateral heel and second and third metatarsals was found to be a common factor in these 17 individuals who developed the condition, with p-values of 0.037 and 0.016 respectively. Though these findings can be clinically useful in the possible treatment for patellofemoral pain, no clear relationship between patellofemoral pain syndrome and any given foot type could be found, with a p-value of 0.788. Finally, we looked at a prospective biomechanical study of the association between foot pronation and the incidence of anterior knee pain among military recruits by Hetzroni 2006. The study group consisted of 473 new infantry recruits who were all examined before commencing a 4-month basic training course. In order to measure foot pronation, two-dimensional measurement of the subtalar joint was performed with inversion and eversion angles of the calcaneus used to classify pronation and supination. Of all the variables tested, only one was found to have a statistically significant association with anterior knee pain. Pronation velocity had a statistically significant p-value of 0.007. However, the study found that this association was not consistent between left and right feet and could not be identified as a risk factor for the development of anterior knee pain. There was no association between foot pronation and the development of patellofemoral pain identified from this study.
Hope you enjoyed our presentation and thanks for watching.